In this video, I answer a question on what causes shooting pain from the neck and down into the arm and how to get long-lasting relief from it without having to resort to injections, medications, or surgeries. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a chronic pain treatment expert with over 15 years of experience specifically for headaches, neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick disclaimer on why I make these videos. I make these videos not to entertain, but specifically for anyone who has been dealing with chronic headaches, neck, shoulder, elbow, or wrist pain for at least 6 months. They've tried just about every type of treatment and has been lied to, overpromised, and underdelivered by the current medical model. My hope is to give some real answers as to what is going on and to get to the root cause of the problem to get some long-lasting pain relief finally. Now on to this week's video. All right, this question came from Jen on Instagram. Let's get right into it. I am 32 years old, yoga instructor who has been dealing with some pretty serious shooting pain, which starts in my neck and goes all the way down into my hand. It seems to do better when I can do any of my yoga work, but I have noticed that the next day, after a heavier workload on the upper body, I wake up in the morning and the pain is significantly worse. I was hopeful that I could help fix it with my yoga practice, but when that didn't help, I saw a few chiropractors and physical therapists who never seemed to give any lasting relief. I also just had an MRI done and it came back normal with only some mild bulging in the lower disc in the neck on the side where I'm having pain. I recently saw a spine doctor and they recommended a series of injections to help alleviate the pain. And if that doesn't help, they want to do some type of surgery where they burn some of the nerves off. All of that seems pretty extreme and something I would only resort to if it were my only option. What do you think is going on with all this? And can it be managed naturally to help me get back to my normal life and yoga practice? Thanks so much for sending that question in, Jen. And just a quick reminder, if you have any specific questions on neck, shoulder, elbow, wrist pain you want me to cover, you're not getting real answers, send them in. And if my question can help, I'll make a video for you. But let's get into this topic here. So what am I going to cover in this video? First, I'm going to cover 3 common causes of shooting pain from the neck. Next is why it feels better during the movement, but a lot worse afterwards. And lastly, how our providers approach the problem to help get long-lasting pain relief. So I talk about this all the time. The most common cause of decreased flexibility, pain, and weakness in the human body is this stuff called adhesion. Adhesion is like a glue that gets inside the muscle, makes it weaker, less flexible. It builds up over time. It's basically just like immature collagen fibers that build up. And you tend to get this a lot more. People usually think you have to have like a direct trauma or injury to get this problem, but more than likely it comes from just bad posture, stress, not moving enough, modern life, modern humans looking at devices all day long causes all those issues, less flexible, weaker. And essentially what happens is when the muscle can't generate the force that it needs to, it eventually goes somewhere else. And a lot of times it goes to structures like discs and cartilage and ligaments and tendons. It also restricts the blood flow. So when the adhesion is in there, blood can't get in to help heal it, but then all the waste product can't get out either. So it builds up as well. So there's more inflammation, more just byproducts of the tissue getting stuck in the cell and in the muscle, and everything just doesn't work how it's supposed to. So then what happens over time is you start to get these things called nerve entrapment. So nerves are basically, they start at like the base of the spinal cord and then make their way all the way out throughout the body. They're built with like 15% of extra slack to keep them healthy and keep them moving and getting where they need to go through the body. But as that adhesion gets bigger and bigger, eventually it gets stuck to the nerve and creates an entrapment. When this happens, you get a lot of things like numbness, aching, burning, tension. A lot of times you can get that shooting pain as well because that nerve is basically getting pinched and compromised, but it's getting pinched and compromised because it's getting stuck in all of that adhesion. Then what happens is when the nerve is entrapped, the body does this thing called like protective tension, where it's trying to take the pressure off of a certain area. Because if the nervous system isn't functioning correctly, you don't function correctly. So a lot of times when people have like these nerve entrapments in these muscles in the neck, on these muscles called the scalenes, what happens is like the shoulder might elevate, might roll back, just to take some of the pressure off of there. The body will really sacrifice a lot of other things around there to protect the nerve entrapment. So a lot of times when people are like, oh, I have bad posture, you have bad posture for a reason because your body's just trying to unload that nerve. It doesn't really care long term, but it puts more damage and wear on all the structures in around the neck and in the shoulder as well. Then what also can happen is down in the arm and actually on the front part of the armpit here, all these nerves kind of come together to control the entire upper arm. It's called the brachial plexus. It's just a ton of nerves in there as well. And then what happens is a lot of adhesion and scar tissue forms in the armpit muscle in the front there. It's called the subscapularis. And then this causes issue as well. And this is when you get a little bit more of that extreme type of pain where it's like really shooting, really stabbing, really burning. Started high up. Now it's working its way down. Cause like I said, that nerve's got that slack all throughout it, but then it just gets used up really quick and can pull and twist in all different ways and cause a lot of issues in there. Another key component is like where the pain goes as well. So a lot of times I get clients in, they're like, oh, I get shooting pain down my arm. And I'm like, well, is it the whole arm? Is it certain fingers? Is it certain parts of the elbow or the wrist? Where it shoots is actually really, really important because it helps me determine where that nerve is actually getting compromised. Another issue that I end up seeing is when providers do recognize that this is happening and they want to treat this area, especially in the armpit or up in the scalenes, they tend to be way too aggressive with it. The nerves need just the right amount of depth, just the right amount of tension to go in there and actually free them up from the muscles. And most times the providers just kind of beat the hell out of the area. It hurts like the dickens when you get it treated and it temporarily feels better, but didn't actually fix anything. So it's really important to make sure it's done right, precise, and focused. And a lot of times when I see this problem in the brachial plexus, it really began up in the neck and then it's a secondary component as well. So a lot of times I don't actually start treating on the brachial plexus. I start a little bit higher up at the source and then kind of work my way down and start to free things up along the path. Then the last one here, and she talked about this, was she got an MRI and they said it was pretty normal and that she just had some bulging. Well, bulging is a big deal to me, especially if you're having symptoms. So this photo over here kind of shows a disc if we like cut it in half and looked at it like from the top of a tree and you have these rings. In the middle here, this blue area here, you have what's called the nucleus, and then it's surrounded by these rings, and then you have different things. And what happens over time is you get different types of tearing in those rings, because like I said, when you have a lot of that adhesion in the muscles around the nerve, the force has to go somewhere and it ends up going to the disc. So when the disc gets inflamed, gets annoyed, that's usually when it's a lot worse the next morning. And that's what Jen was saying. When she gets up in the morning, she's feeling more pain the day after doing a heavy upper body stuff because she really loaded that disc up. And when you sleep, gravity doesn't act on you as much. So your disc actually gets a lot bigger in the morning when you first get up, maybe about 20% bigger. So you're going to have more symptoms in the morning because it's kind of like squished out, and that's going to cause some of those issues as well. And like I said, this happens just from the force has to go somewhere else. And it is important to know that you have bulging. Like if you go and get an MRI and you're having pain, they're like, oh, it's normal. You're only 30. Like, no, it is a part of the diagnosis and part of the pain presentation. So we do have to address for it as well. And like I said, it's worse in the morning just because the disc is bigger. It hasn't had gravity act on it as much. Then a lot of people, they want to resort to getting injections to help take away the pain. The problem is, yeah, it might take away some pain and wipe out some inflammation, but it didn't actually fix anything. So now you don't have that feedback loop anymore telling you that there's a problem, and then you actually damage this a lot more. And I've seen this a lot where people get repeated cortisone injections or epidurals, but the problem becomes worse because you don't have that feedback anymore telling you to stop. And lastly, the whole burning off of nerves thing, that's just crazy to me. I've had a lot of patients over the years that had it done. It's called an ablation surgery. And, the surgeon just goes, your nerves aren't working right. Let's just burn them off. Like, how idiotic does that sound? Like, we're just going to burn some stuff off and see what happens. What happens is the nerves grow back and your problem is 10 times worse down the road. So stay away from that at all costs. So why does it feel better when she's doing movement, but worse the next day? First is this idea of like pain and vibration in the spine. So I'm not going to get too fancy here, but basically on your spinal cord, you have this thing called the lateral spinothalamic tract. I practiced that as I said that. But basically it carries two types of sensations. One is like movement and vibration, and the other one is pain. And essentially what happens is when you start moving, you start stimulating, you start using some muscles, those vibrations start going, that movement goes, and it actually blocks the pain. The best example I can give of this is like when you jam your thumb in the door, you kind of go like this to kind of do that. That's what's happening there. So it's actually kind of counterproductive with the movement because you do feel a little bit better, but you're actually loading those discs and those nerves and that adhesion a heck of a lot more. Chiropractic adjustments, same thing. They're just stimulating some receptors in there, temporarily feels better, but it's not actually fixing anything. This is why she wasn't getting any better with the adjustments. And then corrective exercises with physical therapists, same component, getting in there, moving some things around, blocking some pain, but you're not addressing the actual root cause of the problem, which is the adhesion buildup in the nerves and the muscles as well. And trying to exercise a tissue when it's weak and tight with an exercise is actually counterproductive. You got to get that tissue healthy first by actually reducing and getting rid of the adhesion. Injections and medications, don't do those. They only make things worse. You're temporarily getting a window where you feel better. And a lot of times people will get injections and take medications just so they can go back to doing the stuff that got them in the first place. It's going to be a bigger problem down the road. It's kind of like taking a cash advance out on your credit card. Might help you out in the short term, but you're going to pay a heck of a lot more in the long term. So how do our providers trained in the PEAK method address the problem to get long-lasting results? First is we start with understanding all the components in the pain presentation. We understand that it's not just the muscle, it's not just the disc, it's not just the nerve, it's a combination of everything that is presenting with us. That's why we do a very thorough and in-depth history and a functional evaluation to really get all the data of what's going on so we can get to the root cause of what the problem is. It can be problems in the tissue itself. It could actually just be an inflammation problem with how your diet, your lifestyle, your stress, or it could be the discs and the joints themselves, but it's never just one thing. We live in this society and in the medical world where we want it to be one thing and that one problem only so we can go in there and address it. But a lot of times it's a mixture of a lot of different things. Next is we start by addressing and treating the nerve entrapments first. That's what we specialize in, is finding and fixing those nerve entrapments and treating them exactly right and precise and focused to actually free them up so we get some long-lasting results. Then after we do that, we treat all the adhesion in the surrounding muscles, get all of that out of there. That allows the muscle to become healthier, stronger, more flexible. We also address inflammation by reducing it through diet and some lifestyle. Sometimes we will do some supplementation as well if we need to really get some of that deeper inflammation out there as well. And then lastly, once we do all that, then we build the strength back up. And because when you have a lot of that adhesion, not only does it make it less flexible and inflamed, it actually makes it weaker. So once we get all that adhesion out of there, then we build the strength back up. And that's why physical therapy kind of has it backward. They start to build the strength before the tissue is actually healthy. And then lastly, we really just work on load management, watching your posture, watching your setup at the computer, watching your setup at work. All those things, those little things add up as we go over time to keep this problem from coming back and being worse down the road, where the only thing you have left to resort to is burning off nerves and having surgeries, which have a very, very poor outcome and a lot of high risks. And lastly, forgot one, we do postural awareness and changes, just making sure that you're just trying to mitigate some of the things of modern society where you're just stuck sitting and staring down. Try to make you a little more focused on that and understanding it's important as well, with like some stability work and breathing work and all that stuff. All those things do help, but the key is doing it all in the right order. If you don't, you're never going to actually get those long-lasting pain relief. So that's all I got in the video. If you need help, you've been dealing with this for a long time, the best providers in the world for treating adhesion and nerve entrapments are trained in my system called the PEAK Injury Treatment Method. And when you've had enough of constant shooting pain from the neck down into the arm and discomfort, reach out directly to us and request a no-charge pain consultation to get some real answers as to what is going on and on the path to long-lasting pain relief. Information to request that is included in our profile or wherever you're watching this video. I appreciate you watching. I hope you found it useful, and we'll catch you on the next one.